This is Emily, and today we're going to do our third and last video for musculoskeletal and neurological. Okay, first I want you to put your chin to your chest, chin to the ceiling. Okay, I want you to put your left ear to your shoulder, right ear to your shoulder, look to your left, and look to your right. Okay, looks like your neck is functioning normally, no problems there. Next, I'm going to look at your spine. I'm going to lift your shirt. Okay. First, I'm just going to inspect your spine, making sure everything is symmetrical. Your hips are even, shoulders are even. I'm going to palpate, and you tell me if you have any tenderness, any pain. Nothing, okay. All right. Now I want you to just bend forward. Okay, you get a 90-degree bend. That looks good and straight. I'm looking for smoothness of movement, which you have. Looks good. Okay. All right. Next, I want to check muscles. So I'm going to have you sit down here. I want you to pull your sleeves up. I'm just going to feel these muscles here. And I'm feeling that they're strong, they're smooth, there's no warmth, there's no tenderness. Have any pain when I do this? Okay, let me feel here. Okay. All right, next we're going to check joints. I'm going to look at your shoulders, your elbows, wrists, fingers, hips, knees, and ankles. Okay. What I'm looking for is I'm looking for enlargement, deformity, and any tenderness. So as I feel, let me know if you feel any pain as I do this, okay? First, I'm going to look at your shoulder. You hurt at all? So no pain? Fingers are cold. We'll come back to your hips. No pain around your knees, okay? I don't feel any swelling or anything. And then your ankles. Okay? All right, everything looks normal there. Next, we're going to look at range of motion for you. So I'm going to have you stand up. First, we're going to do your shoulders. I want you to do your arms all the way up to the sky. That's abduction. Then down and across your body. That's adduction. Go straight in front of you, flexion, and then go behind you is extension. Behind your head is external rotation, and behind your back, internal rotation. Okay, so you have good range of motion of your shoulders. Let's do elbows next. I want you to bring them up like this. That's flexion and extension. Good. Let's do something else over here. Put your arm down like that. Straighten out your hand. I want you to put the back of your hand to the table and then the palm. Okay, try the other one. Same thing. So you have good rotation of your elbow. Let's sit down now and do your ankle. Toes to the ceiling and toes to the floor. Soles of your feet to the ceiling and then soles out. And then just kind of wiggle your toes. Okay, so you have good range of motion also of your ankles. Next, we're going to do range of motion of your hips. So if you'll lay back, and I'm going to assess your hip bones while you're laying here because I didn't do those earlier. Have any pain? And I don't feel any deformities or any enlargement. Okay. First thing I want you to do is take this leg, your right leg, and bring it all the way out, straight out. It's abduction and adduction. Okay. Straight up to the sky, flexion and extension. Same with the other. And bring your knee to your chest. It's another flexion and extension. Okay, now bring your knee to your chest and hold it. Now cross your body. That's internal rotation, and then come this way, external rotation. The other one, same way. Good. You have good range of motion of your hips. Okay, you can sit up. For education, osteoporosis is important, especially for women. You're young. Dietary is very important. Make sure that you're drinking a lot of dairy and cheese, yogurt. Green leafy vegetables are important. Exercise is important. Weight-bearing exercise is good to prevent osteoporosis, and it's better to get your calcium from dietary foods than it is to get it from supplements. So remember that. You have any questions for me? Okay. Next, we're going to check. We're going to go to neurological and check your cranial nerves. If you stand up. With this, I'm going to check cranial nerve 2 through 12, and we're looking for presence or absence of problems with this. So, first one we're going to do is we're going to check your optic nerve, and I want you to hold this over your right eye. You want to move up a little bit. I want you to tell me the smallest row that you can read clearly.
DHJBS.
Okay, and then cover your left eye. And smallest row you can read clearly.
EPTZO.
Okay, so your right eye was 20/30 and your left eye was 20/40. That's good. Your optic nerve is functioning normally. Next, we're going to check your cranial nerve 3, 4, and 6. That is your oculomotor, trochlear, and abducens. I'm going to use this pen light. What I'm going to do here is we're looking at extraocular movement. I want you to hold your head steady. I just want you to follow the light with your eyes. We're going to look at peripheral vision, okay? Okay, you did really well. So those cranial nerves work well also, so you have good presence there. The next cranial nerve is trigeminal. I'm going to use this cotton ball. I want you to close your eyes. When you feel this touch you, I want you to say now.
Now. Now. Now. Now. Now. Now.
Okay, good. You can open your eyes. I want you to clench your jaw. And I'm going to feel this masseter muscle. It's very strong and it's equal on both sides. That's a good sign. Your nerve is working correctly. Now clench. I'm going to try to open up this jaw. And I cannot open it, so that the trigeminal nerve is working correctly. Next one is your facial nerve. I'm going to look at your face. I'm going to have you do some facial expressions. I'm looking for symmetry of movement when you do these facial expressions. So I want you to smile. Okay. I want you to frown. I want you to show your teeth. I want you to blink a lot. Okay. Puff out your cheeks. And now I want you to close your eyes really, really tight. And I'm going to try to open them, but you prevent me from doing that. Okay. So your facial nerve is working correctly as well. Next one that we're going to do is your glossopharyngeal and hypoglossal. And I want you to open your mouth, flick out your tongue, and say, I'm not going to get you, and say ah. Okay, so you have that gag reflex. You have a good one going on. So that's working correctly also. The next one we're going to look at is your spinal accessory. I'm going to put my hands on your shoulders. I'm going to push down, but I want you to try to shrug your shoulders, okay? Okay, you are strong bilaterally on both sides. Both of them are equal. You don't have one that's weaker than the other. I'm going to put my hand here. You try to turn your head, okay? And this way. Same thing, strong on both sides. They're both equal, so good. And then cranial nerve 12 is the last one. This is hypoglossal. I want you to stick your tongue out. Just stick it out. Okay. I don't see any deformity there. I don't see any wasting or tremors. That's good. Repeat these 3 words after me. I want you to say light, tight, dynamite.
Light, tight, dynamite.
So you have clear, distinct speech. And I think there's one nerve that I missed was acoustic. I missed that nerve in there. We're going to go back and do that one. What I'm going to do is have you push on your ear like this. And I'm going to say a couple of letters and numbers in there in your other ear, and then you repeat that after me. It's okay, it's okay. It's all right. And I got it, girl. And I got it. And I'm going to repeat it after, you're going to repeat after me, okay? So push on your, just a ladybug. Okay. You pushing?
Mm-hmm. C5B. A91.
Okay, come on this side. Same thing, push on that ear.
XR9.
Mm-hmm.
QBM.
Okay, good. So the acoustic nerve is working correctly as well. Okay, any questions for me? Okay. Next thing we're going to do is the deep tendon reflexes. If you have a seat. Okay, I'm going to... Here, just rest. There we go. Okay, we're going to do this biceps too. Just right here. Nope. Sorry. Like that. Just relax that arm. Relax, relax, relax. Okay, just a 1+. Don't get much more than that on you, do I? Something there, just a 1+. Okay, let's do triceps. I want you to just relax like that arm is just dead. It's just not moving, okay? Just a 1+. Must still make room. Okay, same thing with this one. Just relax.
Hungry?
Yeah. All right, knees. Let the knees dangle. Okay. Oh, there we go. Ooh, that's a good one. Okay. I'm trying to get a good one in here. Okay. And let's do the ankle. And can you scoot back a little bit? I'm sorry. Okay, I get a 1+ on that one. Okay, 1+ on that one. Okay, so you have good deep tendon reflexes there. Okay, next thing we're going to do is do the touch. We've got something that's sharp, we've got something that's dull, and something that's very soft. I'm going to alternate. First I'm going to do dull and sharp. And I want you to close your eyes and you tell me if you feel sharp or you feel dull. Okay, I'm going to do it on your leg first.
Sharp.
Okay.
Dull.
Okay.
Sharp. Dull.
Okay, good. I'm going to have your arms out here.
Sharp. Dull. Dull. Sharp.
Yep, you got all those right. Good job. Okay, now we're going to do the soft. I just want you to say, tell me when you feel it. Just say now. Close your eyes.
Now. 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 Now.
Okay, good. Okay, so that's working well. Okay, you can stand up. We got a couple more things to do. We're going to be finished. Okay, come on over here to me. Next thing I want you to do is just a very shallow knee bend, not all the way to the floor, just very shallow, just bend down, a little bit more than that. Okay, there you go. I'm just looking that you're doing this symmetrically. You're not, one side's not crooked. You're doing it symmetrically, you're doing it very easily. It's showing that your cerebellar function is functioning normally. And do it again for me. Good, and you're doing it, you have strength when you do it, okay. I'm going to do some bilateral hand grips now. I want you to just turn over. I want you to squeeze my hands, both of them. Squeeze, squeeze, squeeze. Oh, okay. Yes, you are very strong bilaterally. Both of them are equal too. If you had somebody say maybe had a stroke and you had them squeeze your hand, one might squeeze and the other not, or one would be weaker. But you're equal, both sides. Okay, next I want you to come over here to this chair. And I'm going to watch you walk. I just want you to walk normally. Just walk to the door. I want you to turn around, just kind of slow walk, and come back to the chair. Okay. So you have a normal gait. You're not, tripping over things or falling or wobbling. You have a normal gait. So that's a good sign for your neurological system. The last thing I want you to do, I want you to come here to me. This is called the Romberg test. I want you to stand with your feet together, hands at your side. I'm going to tell you in a minute, I'm just telling you what I want you to do, but I want to tell you to start. I want you to close your eyes and stand in this position. And we're going to do that for 20 seconds. Okay, and I'm looking for something. I'm not going to tell you what I'm looking for, but I want to see how you do, okay? No pressure. Okay, are you ready? Okay, I want you to close your eyes. Go ahead. Okay, good. Open up your eyes. You have a negative Romberg test, and that means it's normal when it's negative. Somebody that would have a positive, they would be, oh, can't stand up. They'd be falling over, just have their feet together and eyes closed. They would not be able to stand up, but you did fine. Little bit of swaying, but that's normal. I mean, you might feel a little dizzy. That's normal, though. As far as education for neuro, I try to teach everybody about stroke symptoms. There is an acronym called FAST, F-A-S-T. If you come upon somebody that you think might have a stroke, F, facial drooping. Look for that. That could be a sign of stroke. A, arm weakness. We were talking about hand grips. One side may not be as strong. S, speech slurring. If you notice those signs, or even one or two of those signs, the T, time to call 911, because time is very important when a patient has, or a person has a stroke. Sometimes you have just a small window of time to get them help, okay? Any questions? All right, thank you so much.